we will talk about upper left stomach pain. It is very common condition. If we divide our abdomen into 4 parts, then upper left part will be here, and we will talk about upper left stomach pain. First and most common cause is gas and bloating. When person intakes foods high in fiber, or person eats fast quickly, then he swallows air and it causes gas and bloating in the intestines, especially in the large intestine, and it causes upper left stomach pain, because here left side we have bending of colon, and this part is common for gas accumulation and discomfort of left part of abdomen. What is solution at this case? Solution is eating small portions, frequent meals, and eating slowly, and introduce fiber gradually. So if you intake foods high in fiber, introduce it to your body gradually. It's very important. And regular exercise also very important, because exercise causes improved motility of intestines. Second most common cause is constipation. Constipation occurs because of low intake of vegetables and fruits and lack of exercise. So for most people, constipation occurs because of low intake of dietary fibers. And what contains dietary fiber? Fruits and vegetables contains dietary fiber. So low intake of vegetables and fruits causes constipation, and lack of exercise causes constipation, because of exercise causes intestinal motility. And gas and stool is trapped into colon, and it hardens also, and it builds up in descending colon, and person experience left abdominal pain. This pain usually is mild, constant, and dull ache, accompanied sense of fullness and bloating. And what is the treatment? Treatment is intake of fiber, vegetables, fruits, and whole grains, and regular exercise is very important. Also, supplement psyllium is very effective. Also, dried fruit, prunes, for example, is very effective for constipation. And third most common cause is GERD, or gastroesophageal reflux disease. It's very common condition. Generally, it affects around 20% of population. For gastroesophageal reflux disease, classical symptom is not upper left abdominal pain, but burning sensation in the chest is common symptom. But sometimes, if gastroesophageal reflux disease or acid reflux is strong, then when acid back to throat, it can irritate esophageal nerves, and pain can radiate to left part of the abdomen and cause left abdominal pain. It happens, but it's not very common. What is treatment? Treatment is avoiding fatty foods, spicy foods, chocolate, caffeine, and peppermint. And also treatment is proton pump inhibitors, antacids, and H2 blockers. From proton pump inhibitors, common are omeprazole, lansoprazole, pantoprazole. From H2 blockers, ranitidine, famotidine is very common, and different types of antacids also exist, and they are effective for GERD symptoms. And the fourth most common cause is functional dyspepsia. What means functional dyspepsia? It means when person feels full very quickly, even after eating only a small amount of food. People saying, even they eat very few and very small meals, they say that I feel full already, I'm full already. Such people has functional dyspepsia usually. And why functional dyspepsia happens? Because they have sensitive gastrointestinal system. They have hypersensitivity, and even smallest food can cause sense of satiety and fullness. Also, such people can have Helicobacter pylori infection, and this infection is not so strong that cause gastritis, but it still can cause irritation and sense of fullness. That's why people can have functional dyspepsia. For functional dyspepsia, left side abdominal pain is not very common symptom, but still possible. What is treatment at this case? Treatment is eating small portions and avoiding trigger foods, because when person has functional dyspepsia, these persons usually have trigger foods also, which can be fatty foods usually. Fifth most common cause is muscle strain. Muscle strain occurs during contact sport, physical exercise, heavy lifting, and when children running and playing and they say that I have left side pain, it's usually because of muscle strain, and it's usually not problem. So it's muscle strain. If person is physically active and has left side pain, it's not problem in most cases. And another cause is peptic ulcers and gastritis. It's common problem generally, but usually cause pain in middle of abdomen, not left side, but sometimes pain can be left on left side. It's possible, but it's not very common. And pancreatitis is also possible. Pancreatitis is inflammation of pancreas. It's serious condition. It can cause serious pain, severe pain, nausea, vomiting, fever, and it's emergency in many cases. So pancreatitis is serious condition and it causes serious symptoms, severe pain, and it's usually also central pain which radiates to back, but sometimes can be located on left side. And spleen problems also important. It's not common also, it's rare, but if it occurs, it requires attention, because spleen problems occurs first when there is infection, like infectious mononucleosis, for example, because of Epstein-Barr virus. Second, because of trauma. Third, because of blood cancers, and because of liver problems when we have cirrhosis and fibrosis of liver, serious problems. We can have congestion in the spleen also, and spleen enlargement. And spleen enlargement sometimes causes spleen rupture, which is important problem and emergency condition also. And spleen rupture can happen during trauma also. That's why spleen problems always important. And kidney problems can cause upper left abdominal problem. It's not common. Kidney pain usually is flank pain. Flank pain means side and back pain, but sometimes pain can be perceived in front part of the abdomen. And kidney problems and kidney pain can be very severe. It can be one of the most severe pain ever can person experience. So people usually remember kidney problems and kidney pain. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.